Hi, this is Dr. Maggio. We got Taylor here, one of the owners of SPSC CrossFit. We want to get a video on record of showing what we actually did and how a normal patient visit goes. So Taylor came in with a shoulder complaint, so tell us a little bit about it.
Yeah, so basically on my left side, when I put my arm up like this, I just feel kind of a pinch back in like the back of the capsule. It's just not moving back overhead like I'd like it to.
Okay. Had stuff like that before?
Yeah, it's been pretty consistent.
Notice it more when you're doing like overhead stuff, like snatch work or like a push press kind of?
Yeah, definitely snatches, any press overhead.
Okay. No shooting pain down the arm or anything like that?
No, just some limitation.
Okay. So next thing we're going to do is check some motion on Taylor. So if you don't mind popping your shirt off. And what I'm going to do is I'm going to watch some motion from behind. You're going to face the other way. And what I want you to do is go 3 times like this for me. We're going to see what we got here. 1. Any pain with that?
Nope.
And I want you to hold at the top. And if we zoom in over here, what we should see is that his bicep easily touches his ear. We also have a little bit of a hunch here, so that's letting me know that there is some issue going on in here, possibly an infraspinatus, teres minor, or the capsule. So next thing we're going to do is check from there. Have a seat for me, please. Get in here and palpate, see what's going on. So we always check motion first, and then the next thing we do is we go to palpation. Motion's limited, we narrow it down, and what I'm feeling in here first is infraspinatus. Infraspinatus is really important in any pressing motion, anything overhead. And he's definitely got a little bit of adhesion in here through the infraspinatus. Is that tender at all through there?
A little bit.
All right. Next thing we're going to do is have him bring his arm up just a bit, and we're going to check teres minor here. Teres minor, infraspinatus, they're all part of the rotator cuff, and they all have to work in conjunction with each other. And it's rotator cuff, not cup, as some people like to refer to it as. He's definitely got some stuff going on through here. I'm going to have you stand up. We're just going to check that capsule. So back in through here, there's a joint capsule. It's really important for anyone that does overhead work. It needs to really lengthen to allow you to do anything. And a lot of times when that goes bad or has some scar tissue and can't lengthen properly, it causes these other muscles, infraspinatus and teres minor, to have to work a little bit harder. So what we'll do is we'll feel through here. And then I'm just feeling for some tension in here. And definitely you get some right at the top there. Any tightness or pain in there? Kind of know I'm in there. A lot of tightness. So when a capsule is healthy, I should be able to get it up through full motion and not have any problem with it. But when it has some scar tissue, it grabs early and can cause a lot of problems going through there. You can hit pause now. So based off what we found with exam with Taylor and palpation, we found that there is some adhesion in infraspinatus, teres minor, and a lot in the capsule, which totally explains the symptoms. When you're trying to bring your arm back, it just physically won't let you. Your body hits the brakes. So what we're going to do is we're going to treat that capsule first and then clean up infraspinatus, and then we'll recheck it and see how it looks. Hopefully we get better motion and we can see when he goes up that he can easily hit his biceps to his head and has a lot better motion. First thing we're going to do is treat the capsule on Taylor. It's really important, like I said, in any overhead movement. With the treatment, basically we do what's called a pass. I do 5 to 7 passes on it, and what I want to feel is I set some tension and depth, that capsule starts to open up and you get less tension. We always ask the patient too to let us know what they feel, if it's uncomfortable or anything like that. But it should be like a hurts but good, but nothing too bad. So first thing we're going to work here is the capsule, and it's a little tricky to get on. You have to get in. It's in between the posterior deltoid and the tricep. And once we're on it, what I'm going to have Taylor do is lift it straight up. And when he can't do it anymore, I want him to lean away. And that'll be our treatment pass. So we'll start like that for me. Reach it up. And then lean away. Doing okay with that?
Yep.
Good. A couple more. And up. Good.
A lot more tender on that one.
A lot more tender. Can you go ahead for me? Doing okay though?
Yep.
Lean away again. Good. Last one here. Go ahead. So the next thing I'm going to do is we're going to come around and we're going to recheck that motion. All treatments start with a test, treat, retest, and we want to see some type of change. So I'm going to have Taylor lift his arms up again and see what we can find. And see right there, we get in, that bicep is now hitting the ear. That's where we should see it. What do you feel with that? A little looser, a little easier to do?
Yeah.
Not catching as much?
Yep.
So that looks good, and that's what we want to see. The next thing we're going to do is treat the infraspinatus, because it's really important in anybody that does pressing or overhead work. Usually it's the most overworked, but it's overworked because this isn't working correctly. So the next thing we're going to do is have Taylor sit, and I'm going to work that infraspinatus from the side here. And all you're going to do for me is you're going to start your arm just like this. I want you to bring it straight across, and then give it a little bit of a pull there, okay? So what we'll do is, we found where that adhesion is. We're going to set some depth and tension right on it, and then I'm going to have Taylor go through that full range of motion and bring it across. Should start to feel some pressure build up. Doing okay with that?
Yep.
Good. Bring it back. And again. Definitely some stuff in there. When you do have scar tissue or adhesion, that muscle distensions early. A healthy muscle shouldn't. Go ahead. With Taylor's history of being an avid CrossFitter and doing a lot of overhead work, this totally explains what I'm finding here. Good. 2 more. Doing okay?
Yep.
Last one here. Go ahead for me. Good. And I'm going to have Taylor stand up again, and we're going to watch that motion one more time from behind. Hopefully it still looks good, or even better than where we ended. Very nice. How's that feel?
Much easier.
And then I'm going to have you bring that arm up like we had before and kind of bring it back a bit and see how we're really able to open up a lot more like that, a lot freer. So infraspinatus usually is the area that hurts, but what we find is the area that hurts usually isn't the problem, it's just the one getting overloaded. So a lot of people neglect this area of the capsule here because it's deep, it's hard to get to, but this is a main problem causer that causes all of this. The best thing to do is get it assessed and see. If motion isn't good, there's probably some scar tissue in there that needs to be treated. That's what we focus on here at Peak Performance Sports Therapy. If you're trying to find someone that does it as well, you can check out the link below, www.integrativeddiagnosis.com, to find a practitioner area that does this. This stuff really works. It's quick, and we get a dramatic and sustainable result. Thanks for watching, and we appreciate your time.